WHO is working on 4 approaches. The first and most short-term approach is to connect companies who are producing vaccines with other companies who have excess capacity to fill and finish. This could help to speed up production and increase volumes. For example, part of the deal between Johnson & Johnson and Merck announced this week is for Merck to provide fill and finish for the J&J vaccine. We need more partnerships like this, and we need them in all regions. WHO can support this process by identifying gaps and providing a matchmaking service between vaccine producers and companies with capacity. The second approach is bilateral technology transfer through voluntary licensing from a company that owns the patents on a vaccine to another company who can produce them. A good example of this approach is AstraZeneca, which has transferred the technology for its vaccine to SK Bio in the Republic of Korea and the Serum Institute of India, which is producing AstraZeneca vaccines for COVAX. The main disadvantage of this approach is the lack of transparency. The third approach is coordinated technology transfer. This would involve universities and manufacturers licensing their vaccines to other companies through a global mechanism coordinated by WHO, which would also facilitate the training of staff at the recipient companies and coordinate investments in infrastructure. This provides more transparency and a more coherent global approach that contributes to regional health security. And it is a mechanism that would increase production capacity not only for this pandemic, but for future pandemics and potentially for the production of vaccines for routine immunization programs. In fact, WHO has done this before. After the spread of H5N1 influenza in the mid-2000s, WHO supported technology transfer for the production of pandemic flu vaccines to 14 countries, increasing global capacity by more than 700 million doses. And fourth, many countries with vaccine manufacturing capacity can start producing their own vaccines by waiving intellectual property rights, as provided for in the TRIPS agreement. Those provisions are there for use in emergencies. If now is not a time to use them, then when? This is unprecedented times, and we believe, and WHO believes, that this is a time to trigger that provision and waive patent rights. We thank South Africa and India for their proposal to the World Trade Organization to waive patents on medical products for COVID-19 until the end of this unprecedented pandemic. Next week, WHO and our COVAX partners will meet with partners from governments and the industry to identify bottlenecks in production and discuss how to solve them.